Hi everyone, welcome back to another episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurologic Wellness Institute. And on today's episode, we are asking the question, how does increasing vitamin D help decrease COVID-19 mortality risk? How does it improve our risk of not only getting maybe COVID-19, but also the severity of the response, severity of the infection? And I think this is a really important one just because there are still a lot of people that are very threatened and severely should be threatened by COVID-19, people with immunocompromised, people that already have problems like POTS or dysautonomia, people that are obese or overweight or have other health conditions like heart disease, diabetes, autoimmunity. We know that COVID-19 can not only lead to long COVID symptoms, which include things like POTS and dysautonomia and many other factors, maybe even related to some autoimmunity or sparking some new autoimmunity. Can lead to chronic fatigue syndrome. It can lead to multiple things. But for that reason, we need to make sure that we ourselves are doing the best we can to improve our chances and then still be able to kind of get out into the world and enjoy the rest of our lives, right? So this is where improving vitamin D status can be really beneficial to our overall health and then outcome if we by chance run into COVID-19. And so I want to talk about this paper. I want to just kind of walk through it. There are multiple other factors when it comes to prevention for COVID-19, including nutrition and lifestyle changes, but I want to talk mainly about this paper looking at vitamin D and mortality risk. So here we go. It's from the Journal of Nutrients. It's a systematic review. It's a long title. COVID-19 mortality risk correlates inversely with vitamin D3 status, and a mortality rate close to zero could theoretically be achieved at 50 nanograms per milliliter of 25-hydroxy vitamin D3, which is a marker in the blood. And so obviously this was relatively new or recently written here 2021. And if we just are looking at this marker, 50 nanograms per milliliter, a normal rate for the medical world is 30 to 100 nanograms per milliliter for 25-hydroxy vitamin D. But this marker is a little bit higher than that, what's normal. If we can get our vitamin D up to that level, that is going to be much greater for our chances of having a less severe outcome following COVID. So the abstract talks about how blood calcidiol, which is 25-hydroxy vitamin D3, levels correlate strongly with SARS-CoV-2 infection severity. They looked at mortality rates among clinical studies based on age, sex, diabetes. They looked at several population studies. So one population, 7 clinical studies were identified with D3 blood levels at the day of the hospital admission. And basically their conclusion came out to be low D3 is a predictor rather than just a side effect of the infection. Despite ongoing vaccinations, we recommend raising the serum calcidiol levels above 50 nanograms per milliliter to prevent or mitigate new outbreaks due to the escape mutations and decrease in antibody activity. So like I said, I just kind of want to walk through this paper because there's a lot of good things that they talk about. So basically they say here, thus similar to other virus infections such as influenza, we've expected that the effectiveness of vaccination is limited in time, especially with current vaccines designed to trigger an immunological response against a viral protein. We know that people that are fully vaccinated can be infected, so the vaccine doesn't prevent us from getting an infection. It does show that possibly we can have a less severity. So now if we look here, with vaccination still being an important part in the fight, one strong pillar in the protection against any type of virus infection is the strength of our immune system. Unfortunately, thus far this is unquestioned principle that of the whole nature has been more or less neglected by responsible authorities, and that natural immunity is something that is beneficial. Our modern lifestyle is far from optimal with respect to nutrition, physical fitness, and recreation. Therefore, these things can be improved to therefore improve our immune system, therefore have a better reaction to the vaccine and a less response to the virus. So widespread vitamin D deficiency is, or the consequence is widespread vitamin D deficiency, which limits the performance of the immune system, resulting in increased spread of some preventable diseases of civilization, reduced protection against infections, and reduced effectiveness of the vaccine. So if you're trying to get a vaccine to protect you, but you have a low vitamin D, it might not be that protective. This is why vitamin D3 or vitamin D deficiency is so important to fix. Fatality rates correlate well with the findings that elderly people, Black people, and people with comorbidities show very low vitamin D3 levels. Ways to get vitamin D3, cod liver oil. Cod liver oil will help basically prevent low levels of vitamin D3, but ideally getting it through the sun, where then your skin can make, or UV light into the skin, where then the sun can help activate this 7-dehydrocholesterol to then make vitamin D3 is the best way. That'll be in this picture here. So we have 7-dehydrocholesterol. When the sun hits our skin, that, again, cholesterol, this is why cholesterol is good and can be protective. We have more cholesterol in our body. That helps improve or make more 7-dehydrocholesterol, which then in the skin, sun, the UVB wavelength is going to activate it to vitamin D3 or cholecalciferol. Then it goes to the liver, where you have this 25-dehydrogenase that is going to activate it to calcidiol, and this is what we look at in the blood is calcidiol. And then calcidiol can be activated in the kidney, the immune cells, lung epithelial cells, other organs, to basically make calcitriol, which is the active form of vitamin D. It's the active form that is going to have a biological response, which helps with calcium metabolism, regulation of the innate and the adaptive immune system. Okay. So besides vitamin D for COVID, vitamin D has been turned out to be a powerful epigenetic regulator. Basically, it binds to more than 25,000 genes. Every single cell in our body has a receptor for vitamin D, and it impacts dozens of serious health challenges, including cancer, diabetes, acute respiratory tract infections, chronic inflammatory diseases, autoimmune diseases such as multiple sclerosis. We know that activated vitamin D plays a fundamental role in regulating the innate and adaptive immune systems through this vitamin D receptor. They're intracellular. And we know that, again, getting up to 40 to 60 nanograms per milliliter is preferable for many of these diseases we were just talking about. Many recommendations are way too low. So many recommendations for vitamin D3 supplementation only get to the range of about 5 to 20 micrograms per day, which is 200-800 international units or IUs. That's just not enough. It's way too low. Instead, calcium, even when blood calcium levels are high, the culprit for undesired vascular calcification is not vitamin D, but insufficient blood levels of vitamin K2. Basically, people are thinking that if we take too much vitamin D, we're going to have too much calcium. Calcium is going to cause atherosclerosis. That's not the case. We need to increase vitamin K2 with vitamin D. So therefore, supplementing vitamin D3 with 4,000 to 10,000 units IUs, way more than the 200 to 800 international units, is optimal to get that to that 40 to 60 nanograms per milliliter range. Therefore, with that, you should be supplementing with vitamin K2 as well, 200 micrograms with your vitamin D3. It has a protective role against ARDS, right? So acute respiratory distress syndrome caused by SARS-CoV-2. It is this negative RAS modulator, so negative Renin-Angiotensin System modulator. The Renin-Angiotensin System is how this ACE2 expression occurs, and with angiotensin, and we know that the COVID molecule or COVID spike protein binds to ACE2 receptors. So here is the beautiful picture. So the angiotensin or the renin-angiotensin system, renin converts angiotensinogen into angiotensin 1. Angiotensin 1 converts angiotensin 2 by the ACE molecule. Angiotensin 2 is what causes high blood pressure. It can cause tissue injury, pro-inflammatory, it's pro-fibrotic, pro-oxidant, increases oxidants, and this leads to the acute respiratory distress syndrome in severe SARS-CoV-2. Because we know SARS-CoV-2 binds to the ACE2 receptors, and binding to ACE2 receptors help to get entry into the cell. So now if we look at the other side, vitamin D3, when it goes into calcitriol, the actual active hormone, we know that inhibits renin from making angiotensin, decreasing angiotensin 2 eventually. At the same time, it activates the ACE2 receptors, which is what COVID is the COVID SARS-CoV-2 molecule is binding to and inhibiting. And then, so we know that if we can get angiotensin 2 to convert over into angiotensin the 1-7, we know that we have tissue protection, we have anti-inflammatory, anti-fibrotic, and we're going to have a mild SARS-CoV-2 presentation. Okay, so that is how vitamin D3 can really help improve the outcomes of SARS-CoV-2. Here are just some other effects that it affects on the immune system, producing Th1 cells, reducing inflammatory cytokines, therefore reducing the cytokine storm that is classic with COVID. Modulate endothelial function, helps reduce coagulation for those critically ill patients, so now we're not getting blood clots. Vitamin D is very, very important for all these factors. Okay, so then if we scroll down here in their results, so with this plot, this scatter plot, with these different studies, hospital studies, combined data, the AMID study, basically they found that we can get to zero mortality if people get up to, theoretically, zero mortality if we can get up to 50 nanograms per milliliter. But we had much lower mortality the higher we were up. See, the ones that were in like the 20 to 30 range, there are more deaths that are occurring at that lower vitamin D status. Okay, so to conclude, everybody should be taking vitamin D3, especially at the higher altitudes in the winter. Most of the United States does not get good sunlight throughout the whole year, so in the winter for sure, taking vitamin D3, taking 4,000 to 10,000 international units should not be a problem. In the summer, when we get outside, get some sun, get some UV rays, we're making vitamin D. But it's also important that we have a good diet, right? We have diet that does include cholesterol, but avoids sugar and processed oils and other things, because we need the cholesterol to eventually make vitamin D. But we also need to be in a better state where we are not overweight, not obese, not putting our bodies in a place where more damage can occur with an infection. So I hope you guys found this one helpful. I'm sorry if it is something that's kind of on the outskirts, as we are wrapping up with, we're now 2 years into this pandemic. But I hope you enjoyed it. And if you have any suggestions or comments, please leave them below. Any questions as well, leave them below for me too. That would be fantastic. Thanks, and have a great day. Stay healthy.